Alright, as always, you can go to YouTube channel My Medical Nightmare and see 40 plus hours video on everything that happened to me. After a devastating cyber attack hit the computer systems of major U.S. health provider Ascension, 19 states, 140 hospitals, 160,000 associates, 36,000 affiliated providers. Now, an interesting thing has happened in the public discourse following this cyber attack. As you can see, in over 60 hours of video documentation, recorded phone calls, uploaded medical records, and correspondence between Ascension, its affiliates, its partners, etc. on this YouTube channel. Ascension is a bad business. They're rife with corruption. They're responsible for damage to countless numbers of people. Alright, July 25th, 2024. Ascension sell-off of assets continues. Word on the street is there are federal investigations into Ascension. It's going to be one of the biggest healthcare fraud cases in U.S. history. According to the Chicago Tribune newspaper, it was announced that Ascension is selling 9 hospitals in the state of Illinois to California-based Prime Healthcare. According to the article, that's more than half of the hospitals Ascension operates in that state. The third largest city in America, Chicago, is located there. The price of the deal not disclosed. University of Alabama at Birmingham, UAB, recently announced their intent to buy several large hospitals located around Birmingham, Alabama. A figure of $450 million was printed in the media. This follows news published by Crane's Chicago Business newspaper in June of this year that following Ascension, Illinois' decision to outsource hospitalist staff at 10 of its Chicago area hospitals to a private equity-backed staffing firm, more than 1/3 of those doctors and clinicians have left the organization. They estimate around 35% of the 110 full and part-time workers, including medical directors, doctors, physicians, assistants, walked away from Ascension when the outsourcing transition started on June 1st. Since hospitalists were first notified of the labor transition in January, some have been concerned about SCP Health's private equity ownership, a fact they have said will lead to larger patient caseloads at some Ascension hospitals as proposed under the staffing firm's contracts as it seeks to grow revenues. Hospitalists who previously spoke to Crane's argued more patient per provider and other changes to staffing models could worsen patient care quality. Hospitalists also stood to take pay cuts under SCP Health's contracts. The Chicago Medical Society, which represents more than 17,000 local physicians, and the Illinois Nurses Association raised concerns over this deal. It looks as if Ascension is trying to beat a hasty retreat. They're rushing to the exits. And one possibility here is that Ascension was in fact ordered to sell its assets and leave the marketplace. Others have accused Ascension of pump and dumps. They'll swoop into an area, buy up a group of hospitals and medical practices, and proceed to bleed them dry. Business ethics, medical ethics, morals, and the law go in the back burner, an afterthought, in the pure pursuit of amassing money and power. They start running into trouble with regulators and the law. They quickly sell off the hospitals and doctors. Alright, so what's led to all the problems for Ascension? My own case dealing with this hospital as a patient, what I found was after I was misdiagnosed by Ascension doctors and employees, I found I had a life-threatening broken skull injury. Took this issue back to Ascension, the radiologists, etc. They denied any injury existed in their own images, and they would not help me get those analyses reread and reversed. So trying to establish the truth of my injury from the outset, it became a pissing contest. And I think instances such as this is how Ascension is really running afoul. Because they do this to a couple different people, they're going to have quite a few bills and risk piling up. And I'll share my phone call to Ascension CEO Joseph and Pichike outlining my own issues.
You've reached the Ascension System Office General Mailbox. After the tone, leave a detailed message and someone will respond to your call. Thank you.
I'm trying to reach CEO Joseph and Pichike, and he can contact me at that number, and I have a message that I would like to give to Ascension. Between 2018 and 2019, I was an emergency department patient at Ascension St. Vincent's East Hospital in Birmingham, Alabama. I believe I had broken my neck. I had an x-ray, 2 CT scans, and later an MRI looked at by Ascension St. Vincent's doctors. Each time they had told me I had no injuries in this area, I knew their diagnosis was an error as my condition worsened. The area became infected and infested with parasites. By summer 2019, I almost died. I obtained my medical records from your hospital along with the x-ray, CT, MRI imagery and discovered the truth of my injury. I had broken bone in the underside of my skull in the area of the condylar canal and occipital condyle. How the doctors could have missed such a large and serious injury over multiple hospital visits is inexcusable. I believe some element of organized corruption may exist in this hospital. I have compiled over 10 hours of video documentation on what happened to me on my YouTube channel, and the name of the channel is My Medical Nightmare. I believe I may have been a victim of patient dumping in the course of my seeking treatment, which is a violation of EMTALA, E-M-T-A-L-A. When I told medical staff associated with Ascension about my discovery that I had been misdiagnosed repeatedly, I was personally attacked and my psychological state was challenged, and this is reflected in medical records I obtained later. I could not obtain proper treatment or diagnosis for this injury because doctors and nurses that I would subsequently have encounters with would only entertain what the erroneous Ascension ER findings were. My mother, who was a nurse for 20 years, had the misfortune of working in an Ascension hospital. When I questioned my MRI findings involving St. Vincent's Ambulatory Healthcare Network, LLC, and Dr. Michael Brandt Ruff, MD, radiologist, in March 2019. My mother, who was a nurse for 20 years and worked in the Ascension Hospital, she was terminated from her job there around the same time. And so this phone call, I challenge the misdiagnosis of Ascension St. Vincent's East Hospital, Birmingham, Alabama, and I challenge the policy of this hospital. And Mr. Pichike, I think you need to look into this, please. Please listen to my message, look into what I'm saying, and you're free to contact me. Thank you.